Being hospitalized is a really difficult part of any patient's life, but being discharged can be just as difficult. During the hospital journey, patients meet many different specialists. Their medications may change, their activity may change. So going home and leaving the hospital environment can actually be a very anxiety-producing process. The Heart Center received patient feedback that we could improve on our discharge process. In response to the patient's concern, the Heart Center organized a team in order to address our discharge process.
So when I found out about the patient complaint where a patient was lost to follow-up, we did an environmental scan and discovered that there is actually no standardized process for our patients, as every cardiologist and internist office was doing something different. So our team wanted to simplify this for the patients going home who are already overwhelmed with their hospitalization and their travel back to their home community.
Every day, Holly or I will review with our medical team the plan for discharge, and when we're discussing that plan, we ask who the intended following physician in the community will be, as far as either internal medicine or a cardiology, depending on the patient's community. And once we've received the information from the physician, we then present that to our clinical support clerk, and that support clerk then goes ahead and creates an appointment sheet for the patient so they can take that home and know when their follow-up is. Once we have the discharge summary populated in our computer system, the support clerk will then fax that information to the physician in the community, either the internist or the cardiologist, so they have the information prepared for when they have the follow-up appointment for the patient upon discharge.
Before the form, it was just in their discharge summary, and their discharge summary can be anywhere from like 2 to 7 pages depending on their length of stay. So it's a lot more clear for the patients. So now their follow-up is just all on one piece of paper, which is easy for them to track.
Feedback has been excellent. We actually, at 1 year mark, we sent out a survey to all the patients that were discharged from 5A. We sent over 600 surveys and we got a large number of returns. We asked them if they felt that the form that we were using was user-friendly, and it was 100% patients loved the form that we were using. They felt it was easy to read, easy to understand. We also then asked them if they were able to see their family physician within a 2-week period of time, and also with a cardiologist or an internist within our 8-week period of time. And we had great feedback from them. Patients themselves felt they were very well supported with leaving St. Paul's. They had a clear understanding of what the plan was going to be. Cardiologists and internists in the local community also gave us very positive feedback because they had a clear understanding of what happened while the patient was here at St. Paul's and how they could continue the plan moving forward.
Holly, Carrie, and Sam have all been instrumental in working with our community to create a sustainable process for our post-hospitalization follow-up. And Dr. Simone Cowan especially has really been key in creating buy-in and engaging the Division of Cardiology to work in partnership with us on 5A to ensure that every patient leaving the hospital has a clear and communicated plan, because we all know that the patient journey doesn't and cannot stop outside of these walls.
As part of the group, I was quite surprised, but of course honored to be acknowledged by the hospital as receiving an award for this project. I think it speaks to the power of what we can do when we collaborate, when we work as a team. And I think that we can make a difference in terms of improving what we do in order to deliver better patient care.
I think it means everything to us because we truly are in this field to be able to make a difference in patients' care. And by being recognized for this honor, we certainly made a difference in patients' care and made a difference in their journey here at St. Paul's. So speaking on behalf of myself and the rest of our team, we were very thankful and overwhelmed by this honor.